Hi, this is Dr. Kerry Johnson again. We've been doing these things for the last, I don't know, maybe 5 or 6 weeks so far. And I always want to give you a market update on exactly how to talk to your clients and prospects in the upcoming week. A couple of housekeeping points. Number one, make sure you're making 5 RPCs every day. We can make the numbers work if we can get to 38% closing ratio in RPCs, meaning that we're booking appointments 38% of the time, either for the next 7 days or opportunities for the sometime after the next 7 days, 10 days, a month out. We're going to make everything work. So be very dedicated to making your 5 RPCs. And I know that Marlene's team is setting appointments for you also, but you ought to be doing a few on your own. Secondly, make sure that when you're doing these talking points, market talking points, only talk about 3 things, just 3, but not less than 3 and not more than 3. So, for example, a way that you can really make it easy for yourself to do this is just to think in terms of 3s. So say, number 1, Mr. Client, I want to talk to you about. Number 2, I want to make the point of. And number 3, it's important to note that. And then go off to engaging them by saying, how do you feel about this afterwards? And number 3, I know that we're getting away from referrals. You're having appointments set for you now, but referrals are always the best way to get business. They have a higher closing ratio than any other thing that you do. Not only is the higher closing ratio, but you get 25% more money from someone who is referred to you or you referred to them than any other source of business. So here's our talking points for this week. Number 1, there's 27 million jobs now lost. Think of this in terms of 25% unemployment. We know that there's between 110 and 160 million people working in America, not now, but we always think in terms of about 27 to 25%. Number 2, we're seeing a lot of bounces right now. The market goes up one day, the market goes down one day. But here's a really important point. The S&P has 500 companies that they track. Right now, the whole market, S&P, bounces, if you see anything at all, is led by 2 sectors. Number 1 is tech. Number 2 is hospital. Only those 2. So it's not a broad-based S&P. It's called momentum. So when people see some news, the market goes up a little bit. And when they realize that the news is not going to last, the market goes down. That's why we're seeing last week 2% decrease in the market last week. Even though we saw all those bounces up and down, a 2% decrease. And number 3, a lot of people think, well, it's going to be a V-shaped recovery. It's just going to go down, pop right back up. Well, it'll be a recovery. Think about this. When you can feel comfortable sitting next to somebody in a movie theater for 3 hours for a movie, and there's 150 people in the theater. You could go to a sporting event with 80,000 people, maybe like a college football game, and you feel very comfortable doing that. And that's not going to happen until a vaccine. The vaccine is going to happen sometime after Christmas, and even though they're going to put the pedal to the metal, we're not going to see any movement on that. The vaccine is in human trials currently, but all that still takes at least 9 months, even after human trials. Nothing is going to happen until after Christmas. So your 3 talking points this week are, number 1, there's a 25% unemployment, 27 million jobs lost. Number 2, we're seeing a lot of volatility, a lot of bouncing, and it's led by only the news. It's called momentum. And number 3, we'll see a bounce back to business as normal sometime in 2021, not before that. Until we see a vaccine, we're going to see a lot of disruption in business in America, and that will affect volatility, and that will affect the stock market. So keep in mind those 3 points, and when you talk to your clients, you'll be much better informed.